So, Dr. Boone, I think a question that many of us have, do you really think obesity is a disease, or is it a character flaw, problem? I mean, obviously you're advocating surgical treatment, so it must be a serious problem.
Well, most people consider it a character flaw, but it's actually truly a disease, and it was actually described as a disease by the National Institute of Health in 1978, so many, many years ago. And if you compare it to a true disease like heart disease, it has environmental factors, it has social factors, it has medical treatments, it has surgical treatments, and both of them are life-threatening. So it truly is a disease.
Life-threatening. So it's not just about being overweight, it's about the metabolic syndrome. What about this metabolic syndrome?
Well, metabolic syndrome, what you're looking at there is mostly the medical problems that go along with being overweight. But
Right.
some of these diseases are not all specifically related to the weight, but obesity either causes or makes all of these medical problems worse. And those are things like severe diabetes, hypertension, hyperlipidemia or cholesterol, and so forth.
So all of these things are related to being overweight, and each of these separate diseases is deadly in itself. Is that correct?
That's very correct. And we do these operations because they either cure or tremendously improve almost all of these medical problems.
So if we can treat each of these diseases by themselves or treat the obesity, it makes more sense to treat the obesity and all these other things go away. Do they truly go away, or do they are just disguised in some way?
Well, with weight loss, a lot of the medical problems will go away, whether it's surgically treated weight loss, medically treated weight loss. But some of the surgeries actually have some benefits that actually will help keep some of these medical problems away for long term, irregardless of the weight.
So, Dr. Boone, with surgical treatment, even though we can control the diseases, do patients actually live longer?
Patients definitely live longer. Another way to look at it is by being overweight, most of the overweight patients are looking at roughly a 20% reduction in their lifespan because of all the associated medical problems. And part of it's the weight, but most of it's the medical problems that go along with being overweight.
So obesity is a killing disease?
Correct.
Obesity kills people?
Obesity kills people.
Is it about the same as smoking or somewhere around there?
Depending on which study you want to look at, obesity #1 killer in the world, or smoking #1 in the killer in the world, or you throw in the cardiac and diabetes. But when you look at obesity, it's the cardiac, it's the diabetes, it's the hypertension, it's the cholesterol, but it's all part of the morbid obesity, the disease process.
And obesity is associated with an increased risk of cancer, correct?
That's correct.
And surgical treatment actually decreases the risk of cancer?
Well, we know that obesity increases the risk of a number of cancers. And it's breast cancer, colon cancer, uterine cancer for the females, prostate cancer for the men, and probably a number of other cancers as well. By decreasing the weight, we're decreasing those risks. How much of that is that going to decrease the obesity or the cancer risk in the long run? Hard to say, but we definitely think it is decreasing those risks.
I think what's important is that the studies show that that weight loss, weight reduction does decrease the risk of cancer. But since there's no other alternative treatments besides surgery that gives you permanent or long-term weight control, that we have not been able to say this until recently, until surgery became evident, until we studied surgery for longer than 15 years. We didn't really have the evidence to say this, but now that we do, and not just in this country, but in other countries like Canada and Sweden, now we can say that the actual cancer risk is reduced. And I think that's pretty interesting.
That's very exciting. What do you think are the causes of obesity?
I think that's still the question. If we knew the exact cause of obesity and the epidemic today, which is interesting because it's only been the last 20 years that we've seen such a rise in obesity, not just in this country but throughout the world, that we could really target the treatment program. But from what we know, of course, genetics play a big part of it, right? I mean, we look like our parents, we look like our brothers and sisters, we have the same habits. And we know by identical twin studies that, the twins, even separated at birth, still have about the same weight.
Still look similar.
Since you're an identical twin, right? I mean, you sort of look like your brother?
look, sound, act the same. There's two of me in Fresno.
Okay. And so genetics play a big role, but I suspect what's happened in the last 20 years is a change in the environment. And we have much greater access to food. We can store it, we can microwave it, and food is manufactured to be very tasty. I mean, has there been a change in volume of or size of our meals over the last 20 years, you think?
Well, the size of the meals, I think, over the past 20 years has changed tremendously compared to what people ate in the 50s or 60s to where what we eat now is huge. So that's a factor. But also, it's the access to food, whether it's the microwave or the fast food.
Drive-thrus.
It's the type of foods, but also in environmental factors and as far as activities. The internet now puts us in front of a computer most of the time. We played outside till our kids till our parents drug us in. Now we can't get our kids outside to play.
Yeah, well, you have 2 children. I have 4, and I mean, were they allowed to walk to school, ride their bikes?
I rode my bike to school every day. It's not safe to let your kids ride the bike to school.
In the snow, uphill both ways, in Visalia? Yeah, exactly.
So in general, environment is playing a much, much bigger factor over the last 20, 30 years.